Hello, everyone. Thank you all for being here. I appreciate it. This is the last stay-at-home lecture for 2023. Hard to believe that we've been doing this since March of 2020, and it's already been close to, well, over 3 years that we've been doing this. Just a few housekeeping, as we always do during these lectures. I'm Tim Nutt. I'm director of the Historical Research Center, which is the archives and the archives division of the University of Arkansas for Medical Sciences. So we collect and preserve the institutional record of UAMS, but we also collect history of the health sciences throughout Arkansas. So in addition to the departmental reports and correspondence that is generated by the university, we also collect archival materials that document the history of doctors throughout the state, practices, different professions, different health professions around the state as well. So we are located in the UAMS library. We're a department of the library, and we're on the 5th floor of the library in the Education 2 building. And I'd like to invite you, if you're, I always love to show off our collection. So if you're interested, love for you to come up sometime. I'd love to give you a tour and show you some of the artifacts that we have in our collection. Our phone number and email address are on the screen right there. And these lectures are sponsored by the Society for the History of Medicine and Health Professions, which is the friends organization for the Historical Research Center. And the society promotes and supports us in a number of ways, including programming such as this, our annual dinner, which we will be resuming next year after the hiatus for the pandemic. But also they provide financial support in the form of purchasing books and materials for our collection. And the success of the society depends on its members. We have a membership due structure. It's very fairly inexpensive, $5 for student. You don't have to be a student at UAMS. You can be a student at UA Fayetteville, UALR, or anywhere around the country, actually. And for individual, it's $15. If you'd like to join, and I encourage you to do so, you can go to the URL, excuse me, that is shown on your screen, or you can just bypass that and go directly to paypal.me/shmhp and pay your dues there. Our new, we'll be sending out renewal letters in the next coming weeks. So if you are a member, I hope you'll consider rejoining. If not, if you haven't joined already, I hope you'll consider joining. As I mentioned, these lectures, the stay-at-home lecture series, they started in March of 2020 in the pandemic as a way to provide programming that was safe. People didn't have to get out and interact in person with people, and sort of stop the spread of COVID-19. So and they are held every first Thursday, and they have been held from 7 to 8 every first Thursday since the beginning in January of 2024. So next month we are going to switch our time to the daytime, and so it'll be from 12 noon to 1 p.m. still on the first Thursday of every month. And next month it's on January 4th. I will be giving another lecture, and it's going to be talking about the other medical school, a history of the College of Physicians and Surgeons in Little Rock. The College of Physicians and Surgeons operated in Little Rock for a few years, maybe about 5 or 6 years in the early 1900s, and it was a competitor to UAMS, and until their merger in 1911. That's the I'm dog sitting. So I hope you'll join me for that. And then we'll also have we'll also have, excuse me, a lot of new information about the College of Physicians and Surgeons. I don't believe there's ever been a presentation on the College of Physicians and Surgeons. So, and it's an interesting story. So I hope you'll join me for that on January 4th. Tonight, we're going to talk about Dr. Isaac Folsom. And if you're familiar with UAMS history, you probably have heard the name Dr. Isaac Folsom. He was really not affiliated with UAMS, except that he left some money to establish a free clinic for UAMS. And so tonight we're going to talk a little bit about Dr. Folsom, his history, and the legacy that he left for the medical school. So just to begin with, Dr. Folsom, he was born in North Carolina in 1827. We don't really know exactly where he was born in North Carolina. I have not been able to discover who his parents were, and really what part of North Carolina he came from, and when he came to Arkansas. We do know he was in Arkansas before 1860. We do know that. But it's possible that he came to Arkansas before that. And there's a little bit of confusion. There is another Isaac Folsom, I think it's another Isaac Folsom, who shows up in Batesville in Independence County in the 1830s. And so I haven't been able to determine if that's our Isaac Folsom or if it's another individual with the same name. 1830s, it would, that would mean his whole family would have moved to Arkansas, because he would have just been a young child in his around 10, 11 years old in the 1830s. So I don't know. I'm still doing research on that. But anyway, as I mentioned, we do know that he was in Arkansas before 1860. And we know that because he actually joined during the Civil War in 1862, he joined the Confederate Army, and he served as an assistant surgeon during his time in the Confederate Army. And he served some time at the Little Rock Hospital during the Civil War. Other than that, I haven't been able to get a whole lot of information about his service record. If he went anywhere else besides Little Rock, I just know that he served in Little Rock at the Little Rock Hospital. And the Little Rock Hospital, obviously, it was set up during the Civil War to help wounded soldiers. We do know, as I mentioned, that he was in Arkansas before 1860 or around 1860. He does show up in the 1870 census, living in White County around Searcy, the county seat of White County. And there on your screen, you'll see an indication or a citation from the census where it shows that he was born in North Carolina. And he is line 32, if you have a hard time making that out. He is listed as being a physician, and he is living with his wife, Sarah, who is a little bit younger than him. He was listed as being 40 years old, and she was listed as being 27. He married Sarah Puckett in 1861 in St. Francis County. So again, he may have already been living there for a while before he married. We just don't know for sure. They did not have any children, but as you can see, in 1870, they did have a boarder with them, 12 years old, Carlisle, and he's listed as being African American. So, again, I don't know the situation of the relationship between Isaac Folsom and Carlisle. Still doing a lot of research on that. He does show up. He did live in Searcy for a while. He did have a practice in Searcy in the July 1878 commercial agency register. He's listed as a physician. And those numbers that are right beside his occupation indicate the value of his business. So that I believe that 5.5 indicates his business was worth about $3,000, which was quite a bit of money in 1870s. Around this time, probably maybe even before this register was published, he moved to Lonoke in Lonoke County. And that is where he lived until his death in 1895. We do know from the newspaper accounts that he was actively involved in the Arkansas Medical Society, which had been established in 1875. He was listed as, obviously, as I mentioned, he was listed as being from Searcy during presentations that he gave to the Medical Society at their annual conference. And then later on, after he had moved to Lonoke, he's listed as being from Lonoke County. So he was a very active participant in the Arkansas Medical Society, and he would have known, and he would have gotten to know the other doctors, prominent doctors in Little Rock and around the state because of his involvement with the Arkansas Medical Society. And that is most likely his connection, and that's probably why he later left he bequeathed in his will some money to UAMS because of his relationship to the founders of the medical school. I don't know that for sure. That's just a hypothesis on my end, but that's just how I think that's his connection to UAMS. As you know, the medical school was established in 1879 by the 8 doctors that you see on the screen: Edwin Bentley, Roscoe Jennings, Philo Hooper, John J. McAlmont, Augustus Brysocker, Claiborne Watkins, Southall, and I'm missing one, and I can't see it because it's underneath my little menu. James Dibbrell. So, as you're probably familiar with the history of UAMS, the 8 doctors came together. They each provided money to purchase a building for the medical school and to establish the medical school. And they affiliated it with the Arkansas Industrial University, which is now known as University of Arkansas. The medical school was not an official part of the university. It was a proprietary school owned by these 8 doctors. They were just given the right to use the name Arkansas Industrial University with the medical school. It wouldn't be until 1911 that the medical school became a official department or division of the University of Arkansas. So these 8 men, they got together, they decided they wanted to establish a medical school to stop men from going out of state and becoming doctors. They felt like Arkansas needed its own medical school. They pooled their money together. They purchased the Sperandillo restaurant, which had opened in 1873, had gone out of business a few years later. There's an empty building located on 2nd Street in between Maine and Louisiana. And they purchased this building. They each put in $625 to purchase the building for $5,000. And so that's when, and this screen just shows some of the documents from Dr. Hooper's and Dr. Southall and Jennings, some documents about the purchase of the building. So the medical school started in October of 1879, the first session, and it stayed in that building in the Sperandillo restaurant until 1890, when it outgrew its space. So in the late 1880s, more and more students became affiliated with the school. When it started out, there were 22 students. By the time it moved to 1890 to the second location, there were close to about 80 or 90 students in there. So they had run out of space and needed more space. They moved to this building at 2nd and Sherman Streets, which was just down the street, a 3-story building. And this is where they would stay until 1912. And this is where it was at this building that the Isaac Folsom Clinic really came into being. Dr. Folsom, he was living in Lonoke County. In 1891, he drafted his will. And of course, he left all of his possessions and any money to his wife, Sarah. She went by the name Sally. And but in January of 1892, he added a codicil to his will. And in that codicil, he bequeathed money to the University of Arkansas, the Arkansas Industrial University Medical Department, to establish a free clinic for the poor and indigent residents of Little Rock. There's no documentation as to why he did this, why he added that codicil. Again, I think it's probably his relationship with the 8 founders of the school, because of his involvement in the Arkansas Medical Society. Again, that's just my hypothesis on why he did this. But he obviously had he wanted to help the less fortunate than him. It really did turn into something really a good thing that he did. So he passes away in 1892, in September of 1892. This is his the notice in the newspaper where he died, and this was the only mention of it, of his death. At this, there was just a brief mention also of his will and his bequest to the university, but for the most part, his death just warranted just a brief mention in the newspaper. He was buried in Mount Holly Cemetery. This is his mausoleum, the Folsom Mausoleum in Mount Holly. His wife, Sally, she lived for a few decades, a couple of decades later, more, and she died in 1925, and she is also buried in the mausoleum in Mount Holly. So he left $20,000 to the university, which in 1892 was a fair amount of money. I'm not exactly sure how much that would be today, but it would probably be in the hundreds of thousands, I would imagine. So this bequest in 1892 sat there. It was sat in basically a trust, and nothing was done with it. So it kept accumulating interest from 1892 until the state finally decided that they needed to do something with it. And the impetus for that was twofold. One, there was no hospital in Little Rock that really tended to the poor people and indigent people of Little Rock. There was no hospital for people who could afford to pay to go to a hospital. And so the city and the state started looking around and seeing what they could do, and they, immediately thought of this of Folsom's legacy, the money he left to the university. Now, at that time, so this was around 1910. And remember when I said in 1911, the university officially became sort of formalized its relationship with the medical school, and the medical school came under the umbrella of the university. At that time, there were only the hospitals in Little Rock. There was the Logan Roots Hospital, which was right next door to the second medical school. So you'll see the second medical school building on your right, on the right in that picture. And then to the left, the building with the turret is the Logan H. Roots Hospital. So that is where a lot of the medical students, they did their clinical work at the Logan Roots Hospital, which was a pseudo city hospital. And then they also did their clinical work in St. Vincent Hospital, the St. Vincent Infirmary, which was also right down the street from the medical school. It's where it's at 2nd and Sherman Streets. Medical school was a little further east of that. So in 1913, the city of Little Rock and the state is looking around and they're deciding what they need to do to tend to the poorer residents of Little Rock and provide medical care for them. They started thinking about a city hospital, what that would look like, how that would come about. The state got involved in 1913, and they started looking around for land to build a city hospital. Now, around this same time, the medical school moved from this building that you see on your screen on the right. They moved from this building to the old State House on Markham Street, which had just been emptied because the new state capitol had been completed in 1911, 1912. So the state legislature moved to the new capitol, which left the old State House building empty. So the medical school moved into the old State House in 1912, and they would stay there until 1935. They still kept this building at 2nd and Sherman Streets, and this is where the educational part took place at the old State House. Clinical part took place at the 2nd and Sherman buildings. And there was a reason for that. You had the Logan Roots Hospital right next door. And then eventually around 1917, you had the Isaac Folsom Clinic, which was built. So when the state started looking around to build a city hospital, one that was sort of a comprehensive medical center, a hospital for the poor residents of Little Rock, the state looked at land out by the Deaf and Mute Institute on Markham Street, where the deaf school is now. There were 40 acres that the state owned. They looked at turning that over to a city hospital, but they eventually settled on the Isaac Folsom Clinic. The bequest from Isaac Folsom had turned into quite a bit more money than $20,000 by 1916. And so they used that money from the Isaac Folsom bequest to build the Isaac Folsom Clinic right next door to the 2nd medical school. That's a little confusing, I realize that. Just a picture of the old State House where the medical school moved in 1912. In 1915, this process started in 1913. Finally, in 1915, the state legislature passed a bill to establish a state general hospital. So it went from a city hospital to a state general hospital during the legislative session of 1915. And you'll see on the screen where they talk about the property west of the Arkansas Deaf Mute Institute. It's now used as a cow pasture. So they decided that they were going to build this new building right next to the 2nd medical school. And they hired Charles L. Thompson to design the building. Charles Thompson was a prominent architect in Little Rock. He designed many buildings around the state, a lot of courthouses. And so that was sort of a real plum to get Charles Thompson to design the Isaac Folsom Clinic. So he designs the building. This article in 1916 talks about all the different things. In the basement will be the heating plant, kitchen, and everything. And then on the 1st and 2nd and 3rd floors were the different levels of the Isaac Folsom Clinic. So 1st floor was the clinic. You had the top floor where they had the X-ray equipment, and then you had the pharmacy in there. And I have a let me see if I can find this. So here's the description from 1916 of the building. So the building was finished in 1917. Very classic looking building. And the medical school faced 2nd Street. The Isaac Folsom Clinic was behind the medical school, and it faced, I believe it was Ferry Street. So in the basement was the heating plant, kitchen, the dining room, and pantry. The dispensary was on the 1st floor. Each professor will have a private room for the examination and treatment of patients. Every patient coming to the dispensary, that's what they called the clinic, they called it the dispensary. Every patient coming to the dispensary will be treated free of charge. The 1st floor had a waiting room with seating capacity of 100 people. The clinical laboratory was also on that floor. The 2nd and 3rd floors were devoted to private rooms and served as for the care of general hospital cases. On the 4th floor, 2 large general operating rooms, 1 special operating room for eye, ear, nose, and throat cases, the sterilizing room, the anesthesia room, the recovery room, the surgeon's bath and scrub up room, and a modern X-ray laboratory. A modern electrically driven elevator was installed in the building, and the hospital itself had a capacity of 75 beds when it was completed. So that was completed in 1913. Let me back up a little bit. And I found this interesting. In 1913, when they started talking about all this, the Isaac Folsom Clinic they've already started using that name, because the free clinic, which had been maintained in the city hospital, was transferred to the Isaac Folsom Clinic. So they started using the name Isaac Folsom Clinic long before there was an actual building called the Isaac Folsom Clinic. Dr. O.A. Caruth, who was a obstetrician, he taught at the medical school. He was chief of staff for this version of the Isaac Folsom Clinic. Just in 1970, they're talking about the free clinic again. 1917, school year starts in September, and the brand new Isaac Folsom Clinic in the brand new building was opened for the first time. It was open from 12:30 to 3 in the afternoon, and it was staffed mainly by volunteers. Doctors from the medical school would provide their time free of charge to see patients at the Isaac Folsom Clinic. There were only 2 people who were actually on the staff of who got paid for the Isaac Folsom Clinic. Mrs. Edith Hopkins, who was a superintendent nurse at the clinic, and Bertie Sanderlin, who was the keeper of records. So she kept all the medical records. She was also in charge when a patient came in. They signed up, and they were given a number and a card with their number on it. And so every time someone came back, they would bring that card with them, and the patient would be called by that number. They would not be called by their name. They would be called by that number. So that's sort of early HIPAA, if you will. So Edith Hopkins and Bertie Sanderlin were the only 2 paid employees of the Isaac Folsom Clinic. S.B. Hinkle served as chief of staff for the Folsom Clinic. And again, he was an obstetrician as well. And he taught on the medical school faculty as also. Just a few pictures from the school. Here's one from 1921, interns, student nurses, and staff of the Isaac Folsom Clinic. Picture of D.A. Reinhardt with the first. So this was the X-ray laboratory they were talking about on the 4th floor. And this was also the first X-ray equipment that was ever purchased for the medical school. So that's an interesting little tidbit in medical school history. So here's a picture of the medical school in 1923. They were still utilizing this building, and you can see in the far back, you can see the Isaac Folsom Clinic built right behind the medical school. On the left, you can see the Logan H. Roots Hospital, which was still being used as well. So 1922, the Isaac Folsom Clinic, by this time it had been in operation, you know, in name for about 10 years, in operation in its own building for about 5 years. And it had had a huge impact on the population in Little Rock. And the Arkansas Democrat article noted that $100,000 worth of medical service is given to the sufferers. And it was estimated that the clinic saw about 125 people a day, which I kind of find that's hard to believe, but certainly not impossible. But I just find that really interesting and hard to believe that it would be 125 a day, or maybe that was a week. Maybe that was misquoted in the paper, and it should have been a week. But this is a really interesting article, and I want to read some stuff for you from that, if I can find it. So, so it talks about the Isaac Folsom Clinic, talks about the different divisions on the floor, but it talks about, let's see, where they treated people with tuberculosis, they treated people with venereal diseases, all sorts, you know, it was a regular hospital. And so it treated people for a number of illnesses. And I'm trying to see, so it says, no undergraduate has ever been permitted to prescribe treatment or perform an operation on a patient. So the students there were overseen by doctors. They wanted to make that clear. Diagnosis and treatment is entirely in the hands of a staff composed of the most competent and reputable physicians in the city. In fact, a sick or injured person going to the clinic receives the benefit of the combined skill and knowledge of several physicians if necessary, and the various classes of cases are always referred to a physician who is a specialist in that particular line. Let's see. There was a pharmacy connected to the Isaac Folsom Clinic where they distributed, if needed, charge to the patients. The clinic only did minor surgery cases. If there were major surgeries, they were sent to the hospitals, the other hospitals. While the work of the clinic covers all branches of disease, even to nervous troubles, venereal disease and tuberculosis are the two most important items on the list. The clinic is accomplishing an important work in curing patients afflicted with a terrible blood disorder, which constitutes one of the most serious menaces to the social body. And they were talking about syphilis. 1 day a week is set aside for mercury injections, and thousands of cases which had reached the secondary and tertiary stages upon coming to the clinic have been discharged. Last year, and this is in August of 1922, so in 1921, 3,537 men and 5,417 treatments for venereal troubles were administered at the clinic, which is a huge, huge amount. But you also have to consider 1913, Mayor Taylor, Charles Taylor, he wanted to clean up the city because in the teens, in the early 20s, that part of the city where the river market is and pretty close to where the medical school was, that was considered the area where morals were pretty lax. and that was women of ill repute were found in that area. And so Charles Taylor in 1913 wanted to clean up the area. And so it's not surprising to me that there would have been a large number of sexually transmitted disease cases in there. Let's see. Anyway, it's a really interesting article. It's just goes really in depth as to what goes on at the clinic. So it's really a really good insight into the clinic. Here's another picture, one of the operating rooms, 1924. I wish we had some of that equipment for our collection. So by 1935, so the Isaac Folsom Clinic had been built in 1917. The medical school, they were still in the old State House. They were also using the Second and Sherman school building. But by 1935, the clinic had really deteriorated. The facilities had started deteriorating badly. The medical school, the building was deteriorating, and so the city started looking, and the university started looking for where to move, where they would have new facilities, larger facilities, because also the buildings are deteriorating, but also the student body is getting larger. So you're reaching into the hundreds now, hundreds of students for the school. So in 1935, the university reaches an agreement to build the new medical school close to where MacArthur Park is. It's on McAlmont Street. And then the city agrees to build a new city hospital right next to this. Now, building the new city hospital did not exclude the Isaac Folsom Clinic. When they moved into the new building in 1935, Isaac Folsom Clinic operated on the first floor of the new medical school. And it stayed there until 1955, 56, when the school again outgrew its facilities, and they moved to the current location of UAMS. But the Isaac Folsom Clinic continued to operate in that fourth location. Here's a picture from 1936 of the Isaac Folsom waiting room. Very nice facility, waiting room. A technician and a patient in the radiology area of the Folsom Clinic in 1939. But in the mid-1950s, again, they had, as I mentioned, they had outgrown the facilities. The student body, student population had become larger. They needed more facilities. And also the university wanted a true medical center. They wanted a school and a hospital together, so they wouldn't have to rely on St. Vincent's or the Baptist State Hospital or, I think those were the only two in operation in the 1950s. Maybe the Missouri Pacific Hospital was still operating then, but they wanted a true medical center and not have to rely on farming out the students to do their clinical work at the hospitals around the city. So when the current medical center was built in the mid-1950s, the school moved, but the Isaac Folsom Clinic did not move. It was incorporated into the hospital, but there was not a designated area, a designated building called the Isaac Folsom Clinic. They considered the hospital, the university hospital, as the Isaac Folsom Clinic. So that had been incorporated and the name was no longer used. In the McAlmont building, let me go back a few slides. The McAlmont building, there was actually a plaque, a large bronze plaque that hung in the building that talked about Dr. Folsom and his contributions and the impact of the Folsom Clinic on the medical school and the city of Little Rock. When the school moved from the McAlmont location to the Markham location, that plaque was sent to scrap metal, unfortunately. I would have loved to have that plaque in our collection, but unfortunately it did not survive the move. So you can see, from when Dr. Folsom died in 1892 all the way up until the 1950s, and even till today, actually, the impact that he had on UAMS, even though he did not graduate from UAMS, he was not affiliated as a doctor with the medical school, but he left money to benefit the medical school and the people of Rock. He was very active in the community. He was a Mason. Here's a photo from 1885 in his Masonic regalia. He was also a member of the International Order of Odd Fellows, which, their purpose is to make the world a better place. And, I think he really took that to heart in leaving the money for the clinic. As I mentioned earlier, his wife, Sally Folsom, died in 1925, nearly 2 decades after he did. And to me, I think it was probably gratifying to her to see the impact of his gift to the university and the impact it had on the citizens of Little Rock and the medical school. I like to believe that she was really happy with what happened with that. So, and I'll just end with this. Even though the name Isaac Folsom Clinic is not used at UAMS anymore, Folsom is still incorporated and put on the diplomas of the university. So when a doctor graduates from the university, it says, has completed successfully the prescribed course of study, including instruction in the Isaac Folsom Clinic, and has duly and faithfully completed with all other requirements for the degree. So they still acknowledge the contribution that Dr. Isaac Folsom made to the medical school in 1892 on the diplomas of the university. And with that, I'm going to end it, and I'm going to open it up for questions. If you have any questions, please feel free to type them in the chat. And I'd love to hear any comments or any information that you might have heard about Dr. Folsom and his contributions to the university. We have one. Let me I'm gonna stop sharing so I can do that. And let me look at this. Per his obit, he would arrive here. Where was here? So his obituary, they were talking about bringing the body from Lonoke to Little Rock for burial in Mount Holly Cemetery, because he lived in Lonoke. He died at his residence in Lonoke, and his body was brought to Little Rock for burial in Mount Holly Cemetery. So that's what they mean by arrive here. And I just, it's really interesting for such a influential man that he was, that very little research has been done on him. So I'm actually really excited about digging deeper into his history and discovering what else I can find out about him, and hopefully write an article about him and get a little bit more in depth. Another question: if his bequest paid for the building, did it all go to the building, or was that how they funded medical supplies? I believe that it just went for the building. I never found any indication that any of the Folsom money went for supplies. It was just for building, the construction of the building. So I'm assuming that medical supplies was taken from another account. It was funded through the university budget or somehow. I'm not for certain. I'm just, that's my hypothesis. We have another question. I mentioned another proprietary medical school in the 19th century. Did another exist? If so, what happened to it? Yes, Jim. I mentioned the College of Physicians and Surgeons, which was a proprietary medical school. It operated in Little Rock from about, I believe, 1902 until 1910. And in 1911, it merged with the medical school, the UAMS, what is now UAMS. And it did that mainly because it started as sort of as a competitor to the medical school, the UAMS. But it ended because of the Flexner report of 1910. And when Flexner, who went around the country, he to look at conditions of medical schools and to note their conditions and their effectiveness and the strength of their curriculum. He was not kind to the College of Physicians and Surgeons, and he wasn't kind to UAMS either. He actually, Flexner, it was the Flexner report, it was funded by Rockefeller grant, or Carnegie grant, excuse me. And Flexner could not believe that in the city of Little Rock, the size of Little Rock, which 1910 was probably maybe 90,000, maybe 95,000, if that it could operate 2 medical schools. And the curriculum at both the College of Physicians and Surgeons and the medical department of University of Arkansas Medical School was lacking. And so his recommendation was to close either one or close one of the 2. He did not recommend which one to close, but so that prompted the University of Arkansas to take over the medical school, the one that had been affiliated with the university since 1879. That was the proprietary one first. And so the university officially took over the U of A Medical School. It became an official part of the university. The College of Physicians and Surgeons was merged into the UA Medical School. And so in 1911, that merger happened. And one of the conditions was any graduate of the College of Physicians and Surgeons in that 5-6 year period that they were in existence would be considered an alumni of the U of A Medical School. So, but, the College of Physicians and Surgeons, it was located by the river in the old, it was the old Missouri Pacific, or not Missouri Pacific, but it was an old hospital down by the river. If you know where the Packet House is, that Club 1836 now, it's right just to the east of that, where the Dillard's headquarters, one of the Dillard's headquarters buildings located. So it was down by the river. It was a hospital, then it was a seminary, a female seminary, and then it turned into the College of Physicians and Surgeons. I'm not sure what happened after that, but so that closed in 1911. All the physicians that were working at the College of Physicians and Surgeons were incorporated into UAMS, into the medical school for the university. Another question, per the salaried nurse and bookkeeper, were the physicians donating the time? Yes, all the physicians donated their time to the Isaac Folsom Clinic. They were not paid. The only 2 paid employees were the nurse and the bookkeeper, or the record keeper. And people just really rotated through the clinic, and you had all disciplines going through the Isaac, donating their time for the clinic. So you had the chief of staff, who was obstetrics. He donated his time. The anesthesiologist, I would imagine, the bacteriologist, any of the courses that were taught at the university, those physicians that were associated with those courses, most of them, if not all, would have rotated through the Isaac Folsom Clinic. It's a very interesting story, and it really is key to what UAMS does now. I mean, it offers medical care to those who aren't able to afford medical care. So the mission of UAMS started with the Isaac Folsom Clinic. When the proprietary school, they were not necessarily their mission was not necessarily to tend or provide medical care for the poor and indigent residents of Little Rock. So it was only when the Isaac Folsom Clinic came into existence in 1913, physical entity, that the mission of UAMS really started shifting and focusing on serving the poor residents of Little Rock. Any other questions? Okay, well, I appreciate you all for being here. Thank you. Again, I apologize for the dog barking earlier. And I hope to see you on January 4th, where I'll go into more depth in history of the College of Physicians and Surgeons. Again, that presentation will be at our new time from 12 to 1 on December 4th. And if you have any ideas for future presentations, please feel free to send me an email or give me a call. And I look forward to seeing everyone next month. Have a nice holiday and a safe holiday and a happy new year. Good night, everyone.
Good. Thank you, Tim.
Thank you.